Heroin is being called an epidemic here in Cleveland. According to a new study, people who are addicted to painkillers are now turning to heroin as a cheaper alternative. ONN's Kristen Severance has the story.
David Rodriguez is a drug counselor at Catholic Charities in Cleveland. He said 60% of his clients are trying to overcome heroin addiction.
It's like everywhere.
He knows the pain his clients go through. Rodriguez was addicted to the drug for 15 years.
Emotionally, I hit bottom.
He's been clean for the last 2 decades, and he's trying to help others get there. He said many of today's heroin addicts start with another drug, prescription painkillers.
4 people in Ohio die every day from a prescription opiate overdose. And what happens is when you lose your supply of prescription opiates, then you turn to something that's actually cheaper and more available, and that would be heroin.
Dr. Cristinas de los Reyes, Chief Clinical Officer for the Adams Board in Cuyahoga County, says a report by the Ohio Department of Alcohol and Drug Addiction Services surveyed heroin users, the people that help them, and the people that arrest them.
Basically found that heroin was so common it was as if it was falling from the sky.
Dr. de los Reyes and Rodriguez agree, besides treatment, the only way to get a handle on this problem is by telling people about it.
I would deliver this message to the people in Cleveland that have more education about alcohol and drugs.
We have to tell as many people, young people, their parents, pharmacists, doctors, we have to reach as many audiences as we possibly can about what this epidemic is and how it's killing the people of the state of Ohio.
Now, the Cuyahoga County coroner reports that deaths by prescription drugs and heroin overdoses have risen by 79% in the city of Cleveland and by 176% in the suburbs over the last 5 years. It's a huge problem, and you heard the doctor say it. Education is just one way to try to bring these numbers down. Live in the studio, Kristen Severance, the Ohio News Network.